Hi, I am Jalissa High, a psychology and social work major at Bloomsburg University. My topic is about Medicaid in the United States. I chose this topic because I believe it is an important issue that is often discussed in American politics, but people are not always informed about what Medicaid is. In 1965, President Lyndon B. Johnson signed a bill enacting Medicare and Medicaid as Title 18 and Title 19 of the Social Security Act. It was put into place to make mainstream healthcare more accessible for adults 65 and older. States were given a federal funding if they provided services to low-income children, caretakers, the blind, and people with disabilities. Since then, there have been changes to the federal Medicaid law. In 1972, the Supplemental Security Income started. This program was for people who had disabilities. It allowed Medicaid and SSI eligibility to be linked, resulting that someone who qualified for disabilities could also qualify for Medicaid. In 1980s, there was expansions to the eligibility groups and extended benefits to low-income pregnant women and also children. It also allowed the states to expand their care management approaches. There was more added that included nursing home reform provisions to help protect residents and required screening. It also mandated that states have these services eligible for children too. In the 1990s, it allowed children from 6 to 18 to be covered by Medicaid. And in 2010, President Obama signed the Affordable Care Act prohibiting health insurance companies to deny or charge more on a person's health status. This is a big change in healthcare, and now the Trump administration has a different view for Medicaid than Obama did, and time will tell what will happen. They are expecting big changes and could change the way Medicare is run in the United States. Medicaid is a social welfare program that provides health coverage. In 2018, the program covered about 65.8 million low-income families and people, resulting in about 1 in 5 people receiving Medicaid. It covers different health expenses and limits out-of-pocket costs. The program is jointly funded, which means that both the state and federal government share funding responsibilities. States have a lot of flexibility on how they choose to run the Medicaid program while following some broad federal requirements. Each state can have different Medicaid programs. It generally provides 3 types of health protection: health insurance for low-income families and people with disabilities, long-term care for older Americans and individuals with disabilities, and lastly, supplement coverage for low-income Medicare beneficiaries for services not covered by Medicare. In all states, there is some form of Medicaid for low-income families, people, children, pregnant women, the elderly, and people with disabilities. Depending on the state, there may be more people who are eligible, but the list above are required by the federal government. Due to the Affordable Care Act of 2010, it allowed the chance for states to cover more individuals if they chose to. Medicaid is a means-tested program. People's income levels are compared to their state's poverty level, and if they are below a certain percentage, they might be eligible for Medicaid. Each state varies, but a single or joint income cannot exceed 133% of federal poverty level, but some states may be more or less depending on the required income. If a person is single, their worth of cash or other assets outside of necessary items like residency or vehicles cannot exceed their state's poverty level. If a person is married, their spouse can retain up to 50% of joint assets. If someone is disabled, they must be able to medically prove that the individual is disabled. They must also be a U.S. citizen or have a green card. One of the first ways that Medicaid has been affected by the Trump administration is their proposal for a block grant fund for Medicaid. The states would only receive a set amount of money and have to use the money wisely. Currently, the states have an open-ending funding commitment. The Trump administration has been trying to make this change for some time now and will keep pushing it. There has been a lot of pushback and controversy about changing it from an open-ending funding to a block grant. Block grant could mean that states would gain more flexibility. Some argue that block granting would allow the states to be smarter when spending money because less federal strings are attached. Block granting would most likely result in a loss of low income families being covered. There have been several different states that have been granted the approval for the Trump administration to set work requirements and other restrictions to Medicaid recipients. One case in Kentucky, a judge blocked Medicaid work requirements, saying that it was contrary to the program's purposes. But other states have already begun setting the requirement, and it was given the approval by the Trump administration. This is the first time that there has ever been a work requirement set for Medicaid.